Mesothelioma trust funds. Many states have established trust funds to help compensate victims of mesothelioma caused by occupational exposure to asbestos. Trust funds are financed by contributions from companies that manufactured or sold asbestos products. Some of the largest trust funds include the California Mesothelioma Victims Compensation Fund, the New York State World Trade Center Health Program, and the Pennsylvania Mesothelioma Trust Fund. These funds can help cover medical bills, lost wages, and pain and suffering associated with a mesothelioma diagnosis. Applying to relevant state trust funds should be one of the first steps for financial assistance. Asbestos trusts. Dozens of asbestos bankruptcy trusts have been established by companies that filed for bankruptcy in part due to asbestos liabilities. Some of the largest included the Manville Trust, the Babcock and Wilcox Trust, and the C. E. Thurston and Sons Asbestos Trust. These trusts compensate victims who may have been exposed to their asbestos products. Lawyers for mesothelioma patients can file claims to these trusts on their behalf. Trust funds have stringent exposure and medical criteria that need to be met in order to receive compensation. VA benefits. Veterans who developed mesothelioma after serving in the military may be eligible for disability and healthcare benefits from the U.S. Department of Veterans Affairs, VA. The VA presumes mesothelioma is service-connected for veterans who served in specific occupations or locations where asbestos exposure was likely. Eligible veterans can receive tax-free monetary benefits, reimbursement of medical expenses, and enhanced access to VA healthcare facilities to treat their condition. Surviving spouses and dependents may also qualify for benefits after a veteran passes away from a service-connected mesothelioma. Health insurance. All mesothelioma patients should thoroughly explore health insurance options to cover the high medical costs associated with this cancer. This includes private health insurance through an employer, plans offered through a spouse's employer, Medicare, Medicaid, Virginia Health Benefits, and Marketplace or Obamacare plans. Especially for older patients eligible for Medicare, it's important to understand how Parts A, B, C, and D can help cover inpatient care, doctor's visits, prescription drugs, and other expenses. Medicaid eligibility may also apply in some locations depending on income level and assets. Private or individual health plans can fill gaps not covered by existing policies. Social Security Disability Insurance, SSDI, is a federal program that provides benefits to those who can no longer work due to a qualifying medical condition like mesothelioma. The approval process takes several months but provides a monthly cash benefit and Medicare eligibility after 24 months of receiving SSDI payments. Qualification is based on work history and meeting medical disability criteria as determined by the Social Security Administration. Mesothelioma patients over the age of 50 with sufficient work credits have a strong chance at SSDI approval. Charity care and financial assistance programs. Many hospitals and treatment centers offer charity care or financial assistance programs for low-income, underinsured, or uninsured patients unable to afford large medical bills. These programs provide free or discounted medical services on a sliding scale based on income. The social work department at treatment facilities can help navigate application processes for charity care, payment plans tailored to individual financial situations, and referrals to philanthropic organizations that may provide additional assistance. Mesothelioma patient advocacy groups. Several national nonprofits like the Asbestos Disease Awareness Organization offer programs to help financially struggling mesothelioma patients. This includes aid with travel to and from treatment, paying deductibles or co-pays, assistance applying for other benefits, affordable housing referrals, and grocery vouchers. These organizations also maintain funds to directly subsidize medical costs in some cases as a last resort when no other options exist. Doctors, nurses, and social workers can refer patients to patient advocacy support. Clinical trials. Some mesothelioma patients, especially those in late stages of the disease with few options left, may find relief by joining an experimental treatment clinical trial at major cancer centers. In addition to potentially gaining early access to new therapies, Transportation and accommodation costs are usually covered for trial participants. Some trials compensate subjects for their time dedicated as well. While no guarantee of improvement, clinical trials present an opportunity for cutting-edge care at little to no personal financial responsibility. Crowdfunding, as a last resort. Starting a crowdfunding campaign through sites like GoFundMe or YouCaring allows friends and family to each donate small amounts of money to help cover pressing medical costs or daily living expenses. Mesothelioma patients can share their story, treatment goals, and financial needs through an online campaign. While success varies, dedicated personal campaigns have risen tens of thousands of dollars in some cases, which can provide significant support when times are most difficult. Keeping community informed of progress maintains engagement. These represent the most significant and common channels available to help financially support mesothelioma patients and their families during the challenging medical ordeal. Thoroughly researching and applying to each option as early as possible leads to the best chances at having medical bills covered and living expenses supported with assistance from various programs designed for this rare and devastating disease process. Pursuing all angles is important given the associated high medical costs and potential loss of income that mesothelioma patients